Hello there. Welcome to Health and Wellness Program brought to you on Leadership Television. My name is Winifred Weber, and with me is today's my co-presenter, Iye Patience Ejirika. Good afternoon, viewers. How have you been? I've been great. Yes, well, viewers, we are going to be discussing, actually the incidence of cancer in Nigeria is alarming and, of course, quite worrisome. Our guest on the program is the president of Nigerian Cancer Society, Dr. Adamu Uma, who will be shedding more light on and his thoughts on the increasing rate of cancer in Nigeria, treatment, prevention, and how to close the treatment gaps. Dr. Uma, it's a pleasure to have you on our program today.
Thank
Hello.
you. Thank you very much for having me on this program. Good afternoon.
Hello.
Hello,
Like
Dr.
the
Uma, we can't
network
hear
is
you.
there's
Yes, I can hear you loud and clear. I say good afternoon. I'm
Good
glad to be
afternoon.
here.
Good afternoon on our program.
Can you hear me now?
yes, we
Yes, we
can
can hear
hear
you
you.
now.
We can hear you.
Wonderful. So I say it's a
So,
pleasure to
Dr.
be
Uma,
here
welcome
today.
once again.
Thank you very much.
Yes, we are talking about looking at the incidence, the high incidence of cancer in Nigeria. What is happening? What is it, what is happening? Actually, is it people? Is it that people are presenting more with cancer, or the rate is increasing?
Well, thank you very much once again for having me on this program. Well, like you said, the incidence of cancer in Nigeria is on the increase. And well, we can attribute it to some certain factors. First is that the rate of awareness creation, especially in the grassroots, is on the increase, and hence people are now more informed.
Hello.
We're experiencing technical glitch there. Hello,
Hello.
Dr. Man. Dr. Man, are you still with us?
Yes, I'm still with you.
Okay. I
Okay.
Hello,
don't know.
can you
We are
hear
not
me?
hearing. It's not so
Please, can you
audible.
come again?
Yeah, can you hear me now?
Yes, we
Yes,
can.
it's better now.
Yeah, I said the incidence of cancers generally, we can say it's on the increase because the rate at which awareness is being created, especially at the grassroots, at the localities, is on the increase, and hence people do now go for cancer screenings. People do now voluntarily go to seek for cancer counseling and cancer screening. Unlike before, that to even talk about cancer in some places, it's like a taboo because they consider cancer as witchcraft. They consider cancer as something very alien that you cannot come out from once you have it. But now people are more informed, people are more aware, and again, there is a drastic improvement, in the intervention carried out by non-governmental organizations, especially at the level of the grassroots, in terms of screening for common cancers, in terms of provision of screening services for the common cancers of breast, cervical cancers, and even prostate cancers, and in men, and colorectal cancer in some places. So people are now getting to come forward for cancer screening. But again, that is not actually some good news for us because the cancer statistics in Nigeria is still underreported, grossly underreported. Because for every one cancer patient that comes forward to the hospital, if you look at the statistics we are getting now, mostly is from hospitals admissions, is from hospital presentations, and most of these cases that present to the hospital present at very late stages. Very few cases you have where people will go for screening and they will be discovered to have stage one or stage two most instances people present at stage three, stage four, disease stages of cancer, where cancer has already gone to so many other aspects of the body. And this is the reason why, when you look at the mortality rate for cancers in Nigeria, is quite alarming. We are just 1 month plus into the new year, into the year 2023, but already you have over 10,000 new cases of cancers documented. And out of these, you have recorded another 7,000 cancer deaths, So that is quite alarming. It is something that is very scary, and something that we really need to sit up to in order to address, because it is the lack of awareness, it is the lack of early presentation that makes these patients to present to the hospital very late. If you look at the global cancer statistics last year, from the over 120,000 cases of cancers that were recorded, half of that number was also recorded in mortality, about 70,000 or more dying from cancer. And the only way we can improve the statistics is if cancers are detected very early, at very early stages, so that there can be prompt treatment. And of course, many of these cancers, particularly the common ones of breast, cervical, prostate cancers, even colorectal cancers, are completely treatable when detected very early. And that is when the statistics will continue to improve. And this is the reason why we sustain the advocacy towards awareness creation, because prevention ultimately is the key word. Prevention is better, safer, and indeed cheaper than. Hello?
Thank you so much, doctor. Hello, doctor.
Hello.
Yeah,
Okay, you're still
Okay.
with us.
All right.
Okay.
So
yes.
you were talking about early presentation. Can you hear me?
Yes, of course, I can hear you.
Okay. Talking about early presentation, doctor, do we even have enough centers in the country, enough specialists to
Yes.
attend to people? Some people have cancer, they go to the hospital, they are mistaken for other ailments.
Amen. Yes.
So by the time they know that this is actually cancer, is already at a very
Advanced stage.
advanced stage. So now, who do we blame in this case? Is it the patient or the country does not have enough facilities to attend to these cases at the early stage?
Well, yes, the problems with Nigeria is multifactorial, in the sense that you don't have uh, screening services that are supposed to be freely accessible to the populace at the level of the primary health care level. These services are mostly not available. But again, the rationality behind the massive awareness creation we do is that the basic screening services for most of these cancers actually lies in the commitment of the people at the grassroots, particularly the healthcare workers. Let me give you an example. Breast cancer, for example. If a woman is taught how to do self breast examination and monthly, properly how to do self breast examination, every woman will be able to detect any slightest change in her breast architecture. If there is a lump that is benign, that has not changed characteristics, it can easily be picked up. And that will be the beginning where the woman will now seek for proper medical attention. Again, when you look at the cervical cancer, for example, cervical cancer, most of the diagnosis is from the basic examinations that physicians do. Now, the problem we have is that we don't have the qualified physicians that will do vaginal examination using speculum. So usually it's when you go to the hospital, and our women have this habit of not going to seek for medical attention in terms of maybe an annual medical checkup, until maybe when they are sick, or maybe when there is a problem, before they go to the hospital. But it is encouraged that every woman should go and have that check at least once in a year. Even the pap smear, the pathology, the histology test that is done to detect cervical cancer, is done mostly in most hospitals free of charge. And for so now, Now, the basic ingredient there, like you said, is that the manpower is not there. Aside the awareness, the manpower is not there, and this is why we are calling for, routine screening in all our primary health care centers, so that our women will have these lesions detected early. Most of them are detected at precancerous stages. And when they are detected at precancerous stages, nobody will even be talking about cancer, so to speak, because these lesions at precancerous stages are early, I mean, easily treatable, and the woman will go home held and hearty, and there will be nothing like a cancer diagnosis again. So now, uh, this is where government has to come in. This is where government has to truly improve in terms of funding for healthcare generally. We are still battling between 5 to 7% of budgetary allocation to healthcare, as opposed to the 15% that all African countries agreed, in Nigeria inclusive, at the 2001 Abuja Declaration, where they pledged to allocate at least 15% of their consolidated budget, annual budget required to healthcare. Without proper funding for healthcare, there is no way you can fully equip and fully manage the primary healthcare centers across the country. But that is the panacea towards an increase in the number of cases of cancers, an increase in the statistics of treatable cancers, and of course, a significant increase in the number of persons that are screened to have cancer. For example, cervical cancer elimination strategy, as developed by the World Health Organization, envisaged that at least 90% of women, eligible women, should have been screened, you know, uh, of cervical cancer. 70% of women that have 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 been detected to have cancer are treated, and of course 90% of our young girls between the ages of 9 to 16 are immunized against human papillomavirus vaccine. So these are purposeful drives that government of Nigeria can key in, so that we can make some progress in towards eliminating this monster called cancer. But I agree with you that we are still very far behind. The little efforts that our non-governmental organizations, members of the Nigerian Cancer Society, that are doing at the level of the grassroots is not really adequate, because the population of Nigeria is growing by the day in a geometric progression, and these little efforts in terms of screening services provided by non-governmental organizations will not be enough to cater for the teeming populace. So government has to be decisive. Government has to be committed in channeling more resources towards primary health care and towards screening services at that level. Thank you.
Thank you so much, Doctor, for that analysis. Now, I want to find out among all the cancers, which of them is more prevalent in the country?
Well, something that will be of interest to many of us, or all of us, is the fact that most of the common cancers, most of the common cancers are highly preventable, and most of them are highly treatable when detected very early. 1/3 of most cancers are highly preventable. Another 1/3 highly preventable. So already you have like 60% of most of these common cancers either preventable or highly treatable. But of course, the caveat is when detected early. Now, it's not only in Nigeria, but across the world, there are three common cancers that affects every region the world over. And these three common cancers are: first, the breast, cancers of the breast in women, and 1% of men, because breast cancer also affects 1% of male. Second is cervical cancer, and the third is prostate cancer. In some places, prostate cancer has overtaken cervical cancer. But for us in Nigeria, these are the core common cancers that we have. It's after these three common cancers that constitute the significant percentage of the burden of cancer in Nigeria that you now begin to have other forms of cancers, the colorectal cancers, the lymphomas, the leukemias, childhood cancers, and indeed other forms of cancers. Don't forget that basically every organ that is living in the human body can develop cancer, and that is why we say cancer is a spectrum of disease entities that can constitute over 200 different cancers, because basically everything that is living in the human body can develop cancer. But like I said, these three cancers are the most common cancers in Nigeria. And if you look at the statistics, when you go out to the hospitals or even on the streets, and when you do a survey, you will discover that these are the common cancers that we have in this our environment, and in fact, the world over.
Okay, doctor, talking about cancer management and treatments, are there new developments? Sir?
Well, I am not a clinical oncologist. I am not a cancer specialist per se. I am a patient advocate. I am an advocate for prevention of cancers. I'm an advocate for the early treatment, early diagnosis, and early treatment of cancers. So our target is to have a world free of cancers, is to have a Nigeria free of cancers, and then for those that have the disease cancer, it is our target for them to have a better way of life. And so, for this reason, um, we can say we have developments when we talk about advocacy from our advocacy angle. We can say we have a lot of developments in the Nigerian cancer space. For example, the federal government of Nigeria has this fund that is called Cancer Health Fund. The Cancer Health Fund is meant to cater for indigent cancer patients that cannot afford care. It covers breast, cervical, and prostate cancers, and there was in six pilot hospitals, one in each of the medical zones. So to us in the advocacy cancer space, that was a very massive improvement from where we were when patients were basically paying out of their pockets for every aspect of cancer care. Just recently, the Ministry of Health, Federal Ministry of Health, made an announcement that they are adding more hospitals to this cancer health fund, and they are also expanding the cancer access program. The cancer access program is another innovation by the Federal Ministry of Health and their partners, where patients that can afford in a way to procure their own medicines for cancer will pay 50%, and government and their partners will pay the other 50%. So there is also a recent development that now this cancer access program that was in about 20 hospitals across the country will now cover basically every tertiary health institution in Nigeria. And now again, the cancer, the National Health Insurance Authority Act that was amended to made it now National Health Insurance Authority Act, that made it compulsory for health insurance coverage for all Nigerians, be it in the formal or informal sector, and of course, again allocating a certain amount of money in the annual budget to cater for what we call the vulnerable fund that will bring out about 72 million vulnerable age groups in Nigeria, usually the children, the elderly, and the less to do in the society, so that they can have some form of coverage. And another drive that is currently ongoing for a holistic approach at addressing the guidelines, the implementation guidelines of the National Health Insurance Authority, so that there will be complete coverage for cancers. There will be complete coverage for all vulnerable age groups in Nigeria. Now, this is actually a massive development for us in the cancer advocacy space because it will now bring more succor to our cancer victims, to our cancer survivors. It will now bring more affordability in terms of cost for care because as it is now, over 80% of Nigerians pay for their health care out of their pockets. And you can imagine a situation where somebody is struggling to get what to eat. Uh, the primary objective or the primary concern for that person will be what to put in the stomach, not what to use to go to the hospital or what to pay for cancer treatment. And cancer treatment is very expensive, not only to the ordinary Nigerian, even to the rich, cancer treatment is very, very expensive. So, yes, we still have a very long way to go in the sense that we don't have the specialists that are supposed to cater for our teeming cancer patients. Nigeria is a country that has over 200 million people, but we can only boast of having less than 100 clinical oncologists, the specialists that treat care. The radiotherapy machines, uh, these machines that are used to treat cancer patients, we are still struggling to meet up to get 10, 13 or so machines, both government and private. Whereas we are supposed to have, with our population size, we are supposed to have at least 300 radiotherapy machines. There should be a radiotherapy machine, ideally, in the general hospital in my village. There should be a cancer specialist in the general hospital in my village here in Yobe State, where cancer patients can access care. But that is not where we are currently. But we remain optimistic that things will change for the better and that we will make a great deal of progress in that direction.
Thank you so much,
Thank you,
Doctor.
doctor.
We were not hearing you. The network is so poor. Anyway, before
Oh
we
my
go,
God.
uh, Patience, you have a question to ask. I have a question to
We
ask.
can ask.
Doctor, I just want to find out what is the rough estimate of Nigerians that are living with cancer?
Well, you see, like I said earlier, according to a recent statistics released by the International Agency for Research in Cancer, in just 33 days of the year 2023, Nigeria recorded 10,000 new cases of cancer, various cancers, that is. And out of this, well, not out of the new cases, but within the same period, we recorded over 7,000 people that died of cancer. And in this year alone, 2023, it is projected that over 140,000 Nigerians will have cancer, will develop cancer. And out of this, maybe only 40,000 will survive this disease. So it is a very alarming statistics. And the reason for the high mortality is because of the late presentation, like I said, because of the various taboos associated with cancers, because of the way people take things for granted that this is cancer, don't go to the hospital because it doesn't like injection and all that. And before you know it, it has already gotten to terminal stages. It has spread to other organs of the body. And by the time you go to the hospital, it's usually palliation that will be provided, and the patient is dead. And it adds to the alarming statistics that we already have. So, but the the reality is that to us as cancer advocates, cancer statistics in Nigeria are actually underreported. And this is why, as advocates, we are happy. The federal government currently is implementing the National Institute for Cancer Research and Treatment. And one of us, a clinical oncologist and a staunch cancer advocate, in the person of Professor Usman Aliyu Malami, was recently appointed as the Director General of that institute. And this is where you talk about cancer research, This is where you talk about research in treatment modalities, and this is the panacea that we need to be able to provide positive impact, to be able to provide genuine treatment modalities that are localized here in Nigeria, not using foreign examples or foreign models of treatment. And we believe that the statistics or the outlook will change in the years to come by the grace of God.
Thank you so much, Doctor. We really appreciate you for your presence in our program today. That is a health and awareness on leadership television. Of course, for viewers, we've been talking about the growing rate of cancer in Nigeria, the management and treatment of it. And we had as our guest, a virtual guest, Dr. Umar, who is the president of Nigeria Cancer Society. Thank you so much, Doctor, once again.
Thank
And we
you.
look forward to having you all on the program.
Thank you,
Thank
Doctor.
you so much. Thank you so much for having me. I look forward to joining you physically in the studio so that the network will not be an issue
Oh yes,
Oh,
that,
yeah,
in
great.
that
That
another
would
would
be
be
so
great.
good
episode.
to have you.
That would be great,
Yeah,
sir.
Physically in the studio.
yeah,
Thank you.
Great,
yeah.
sir.
Thank
Yeah. So we'll be running up here. Thank you, our viewers, for joining us today. We'll be back same time next week. We want you guys to join us again. Bye for now.
Thank you for watching. For sponsorship and advert placements, please contact 080-3688-6158. Last Word Leadership Podcast Studio. You have the last word.